Welcome to your training on COVID-19 key messages and vaccination information. This short training session has been recorded by health improvement specialists in Leeds City Council to provide key public health messages around COVID-19 and the current vaccination programme. This webinar will provide you with key information to support conversations when working with people in Leeds to enable them to make informed choices around the COVID-19 vaccination. In this session, you'll be provided with a COVID-19 overview, which will reiterate what COVID-19 is and the origins of it. It will then look at the changing symptoms of COVID-19 and how these have changed over time with the rollout of the vaccination and different variants. The training will provide some information and facts on vaccines to dispel some of the urban myths around this before looking at vaccine inequalities in terms of uptake. Finally, the training will provide you with some resources for support and information on how you can support the vaccination programme in Leeds. COVID-19 is a disease caused by a virus and is often referred to as coronavirus. It belongs to a family of viruses that can cause illness in humans and animals. It is passed from person to person directly or indirectly, mainly by large respiratory droplets. The virus itself mainly affects the respiratory tract, and severity of the infections can vary significantly from person to person. The droplets are produced from sneezing, coughing, speaking, shouting, and singing, and these can be passed either directly when in contact with someone who is sneezing or coughing, for example, or indirectly by touching contaminated surfaces. Therefore, if you think about how many surfaces your hands and others' hands touch in a day, you can appreciate how easy it is to pick up the infection. COVID-19 was firstly identified in China in December 2019, and since then there have been over 244 million confirmed cases and nearly 5 million deaths worldwide. In the UK, the first case was identified in January 2020, and since then there has been nearly 9 million confirmed cases and over 140,000 deaths. And in Leeds, the first case was identified in February 2020, and since then there has been just over 129,000 confirmed cases and 1,900 deaths. It's worth mentioning here that all of our lives over the past 20 months have been affected by the presence of COVID-19, with a number of lockdowns and restrictions in place. And more recently, we have seen the easing of some of these with the rollout of the vaccination programme. At times, it's easy to think that it's over now, but it's important to remember that COVID-19 hasn't gone away. We are just in a very different position. It's also worth noting that the numbers of infections have increased in waves as new variants take hold. For example, the Alpha variant caused a rise in September 2020 and the Delta variant from early April 2021. The mutation of the virus can happen at any time, and monitoring is always underway to check for new variants. This is especially important to make sure the components of a newfound variant cannot escape the vaccination. There are many different symptoms associated with COVID-19, but the common symptoms for unvaccinated people are a new continuous cough and/or a fever, which is classified as a temperature of above 37.8 degrees Celsius, and a loss in change of normal sense of smell or taste. It is important to remember that everyone experiences different degrees of symptoms, and some people have no symptoms at all. This has been known as being asymptomatic. It is also important to remember that these symptoms may differ depending on the variant of the virus. For example, these symptoms were less common with the Delta variant, as discussed in the previous slide. Furthermore, the ZOE study has evidence that symptoms of COVID-19 have been reported to be different for those people who are fully vaccinated, where they have reported that common COVID-19 symptoms include a runny nose, a headache, sneezing, and a sore throat. The previous traditional symptoms, such as loss of smell and shortness of breath, according to this study, are less common for those who have had 1 or 2 of their COVID vaccinations. And a persistent cough is no longer the top indicator of having COVID. I suppose what is important to take away from this is that if you or anyone you know experience a range of symptoms that could be related to COVID, it is important to get a test, even if you've had 2 or more vaccinations, and you need to self-isolate for 10 days in the event of a positive result. It is also important to remember that anyone can be infected with COVID and pass it on to others, even though you could be fully vaccinated. For most people, symptoms of COVID-19 are mild, but for some, it can lead to long-term effects known as long COVID or death. It is estimated that long COVID affects 1 in 10 people, so 10% of the population. And therefore, based on the figures we looked at on the previous slide for infections in Leeds, approximately 13,000 people will have been affected with the side effects of long COVID, of which symptoms can include extreme fatigue, shortness of breath, chest pains or tightness of the chest, problems with memory and concentration, which is described as a brain fog. So how do we reduce the impact of COVID-19? The main way of doing this is to get vaccinated. Vaccinations reduce the severity of the illness if you are infected with coronavirus. It does this by preparing the body's natural defences, the immune system, to recognise and fight off the virus and the bacteria they target. After a vaccination, if the body is later exposed to the disease, the body is immediately ready to destroy them, preventing severe illness, hospital admissions, or even death. There are currently 3 approved vaccines used in the UK. These are Moderna, the Oxford, which is also known as AstraZeneca, and the Pfizer Biotech. All 3 vaccinations have been used in the UK and reduce the chance of severe illness if you are infected with coronavirus. The vaccine offer is available for anybody over the age of 12. Those over the age of 18 will be offered both doses of the vaccine, and those between 12 to 17 are currently being offered 1 dose of the vaccine. You usually cannot choose what vaccine you were given, but you will only be offered vaccines that are suitable for you. For example, if a person is pregnant, they will only be offered the Pfizer or the Moderna, and anyone under the age of 18 will be offered the Pfizer only. In terms of the rollout of the COVID booster, you may receive a different booster vaccine. Those eligible may receive a different vaccine to their original vaccination, with the Pfizer and the Moderna being offered. Again, if someone for a reason cannot have these vaccinations, they will be provided with an alternative. Drugs have also been used to treat the symptoms of COVID, and some widely available and inexpensive steroids have proved very effective in doing so. More recently, an antiviral that can be taken at home to treat mild to moderate symptoms of COVID has been approved as being safe and effective in reducing the risk of hospitalisation and death. So why should we get vaccinated? The first reason is quite simply because it is the best way of protecting yourself. Research has shown that COVID vaccines reduce the risk of being seriously ill or dying from COVID-19. It reduces the risk of catching or spreading the virus and is effective at protecting against different variants of the virus. The second reason depicted in the illustration shows the concept of herd immunity and outlines the reasons of being vaccinated to protect others in the community who may not be able to have the vaccination. Some people in the community, due to underlying health conditions that weaken their immune systems, such as cancer or HIV, or those who have severe allergies to some vaccine components, may not be able to get vaccinated. These people can still be protected if they live in and amongst others who are vaccinated. As when people in the community, these people can be protected if they live in and amongst others who are vaccinated. As when a lot of people in a community are vaccinated, the pathogen has a hard time circulating because most of the people it encounters are immune. What this means is the more that others are vaccinated, the less likely people who are unable to be vaccinated will be protected. Herd immunity will not provide full protection, but those people who are vaccinated around them provide them with the protection, thanks to them being vaccinated. In short, another reason to be vaccinated is not to protect yourself, but others in the community who are unable to be vaccinated.
The COVID vaccine rollout has been successful in many ways, with a large proportion of the population having their first and second doses, as well as over 13 million having a booster vaccination as of November 2021. The data for this information changes and is updated on a daily basis, and it is therefore worth visiting coronavirus.data.gov.uk for further information and up-to-date data on cases, vaccinations, testing and deaths. The information is public data and can be shared with others who may benefit from understanding the statistics. There are many people who have not yet received either any or both doses of the vaccine. There are many reasons for this, ranging from fears about the vaccination safety to distrust in the healthcare network and practical barriers such as accessing a vaccination centre, and we will explore this more in the next couple of slides. This inability or reluctance to vaccinate represents an inequality of vaccine uptake. This slide shows a map of Leeds and the surrounding areas depicted by green or red boundaries and a percentage for each area. This percentage represents those people registered with a GP and over the age of 16 who have not had the first doses of the vaccine. The data is accurate from end October 2021. The map shows clear pockets of clusters where the vaccine uptake is much poorer than other areas, and this is particularly apparent in Little London and Woodhouse, Gipton and Hare Hills, where over half of the over 16s population in these areas have not taken up the vaccine offer. It is important to understand the reason behind this and having meaningful discussions based on facts to support and educate on the importance of the vaccination programme. Many of the barriers to uptake of the COVID vaccination are linked to inequalities, and the area is very complex. Research indicates that many individuals and indeed communities mistrust services and government agendas, resulting in disbelief about key messages and the belief that there are additional hidden agendas. You have probably heard people talk about being chipped by the vaccination, or that it is tracking device, for example. Vaccine hesitancy is another barrier to vaccination uptake. This is defined as a delay in acceptance or refusal of vaccines despite availability of vaccination services, and this represents a significant barrier to vaccination uptake. In terms of COVID-19, several factors contribute to vaccine hesitancy, of which the majority factors are relating to fears of side effects. This in relation to people fearing that the vaccination will make them unwell, and for many, the belief that they are unlikely to catch the virus. And if they do, they are strong enough to overcome it, and they therefore question why they should take the vaccination offer. In response, it is therefore worth remembering that you are far more likely to be seriously injured by a vaccine-preventable disease than by a vaccine itself, and many side effects from a vaccine are usually short-term and minor. In short, the benefits of the vaccination greatly outweigh the risks of having it. Distrust in the vaccine also causes vaccine hesitancy, with people feeling that the vaccination was rushed and had not been thoroughly researched or tested before being rolled out. Again, key messages here is to reiterate that any licensed vaccine is rigorously tested across multiple phases of trials before it is approved for use, and regularly reassessed once it is introduced. Despite the speed that the COVID-19 vaccination was developed, it has still been subject to all the same rigorous checks and scientific regulations as many other vaccines. Perceived effectiveness of the vaccine is also a reason people are hesitant about having the vaccination, and most of this stems from the fact that they can still catch COVID-19 once they have had the vaccination. And indeed, this is true, but as previously mentioned, symptoms of COVID-19 from vaccinated people are less severe, result in less hospitalization, and therefore reduce the risk of serious illness. As well as the above barriers, there are many other vaccine myths and misinformation that are difficult to dispel. This makes it increasingly difficult to separate fact from fiction when understanding and educating others on the COVID vaccination programme. For example, myths surrounding the effects of the vaccination on fertility have been circulating on social media platforms, but there have been no evidence and, more importantly, no biological possibility that COVID-19 vaccinations can affect this, but the news is too widely spread that many believe this to be the case. When we look at what is currently being done in Leeds to tackle COVID-19 vaccine inequality, we draw on the work of the No One Left Behind campaign. This was introduced to ensure Leeds City Council work alongside NHS to encourage all eligible communities within the city to take up the COVID-19 vaccination offer. This has a particular focus on place, communities of interest and underserved populations. The No One Left Behind campaign provides alternative vaccine offers to improve accessibility to the vaccination rather than attendance at one of the established COVID vaccination sites. Ongoing initiatives to do this include a roving vaccination bus. This has been dedicated staff supporting the vaccinations and moves around in areas where people are finding it difficult to access a vaccination site. Pop-up walk-in clinics in a range of venues such as places of worship, community centres, shopping centres and festivals are also available alongside women-only clinics and on-foot vaccination teams. Ongoing work with other organisations across the city is still underway to assist with targeting those people who may face barriers to accessing the vaccine, such as sex workers, the homeless and drug users. And of course, ongoing work with local community champions and third sector organisations continue to raise awareness and educate to help tackle uptake in certain areas. In terms of what support you can offer as a community champion, the first thing to say is on a personal level that you should get vaccinated if you are eligible, to reduce risk to yourself and others around you. The evergreen offer for anyone eligible to access their first dose of the vaccine continues to be available by booking an appointment or going to a walk-in clinic. If you are eligible for your booster as you had your last vaccination over 181 days ago, make sure you are booking this to stop waning immunity and boost your protection. Encourage others eligible to get vaccinated. This might not always be easy given the barriers we have previously discussed, but some top tips are to ask questions and use effective listening. Provide the facts rather than your personal opinion, and signpost and support people to resources to make informed choices. We have provided some useful resources on the next slides, but there is a vast amount of information on the NHS website to answer questions you might be asked, or you might have yourself. Following the training, there may be some question and answer. Following the training, there will be some question and answer sessions set up with a representative from the health protection team, and it is therefore important that you attend the questions and answer session if you have any questions relating to this subject area. Finally, it is important to remember that everyone is different and everyone has their own reasons for the decisions that they have made regarding vaccination status, therefore, when holding conversations. Use age-friendly principles and effective communication when addressing your audience. This might include adapting your methods of communication and the language you use. Treat people fairly regardless of their views and opinions. There are a lot of online resources available to read, guiding you through the facts around COVID-19, symptoms and vaccinations. These can be found on the CCG website, Leeds ccg.nhs.uk, the Public Health Resource Centre at www.leeds.gov.uk, and the NHS Coronavirus Advice page on the NHS website www.nhs.uk. I hope you have found the information useful and informative. Please attend the question and answer sessions if there is anything that you would like to know more about or any questions you have regarding the information you have been provided with.